Assalamu alaikum and hi everyone. Today we're going to learn on type 2 diabetes. Stay tuned. Insulin is produced by beta cells, specialized cells located in the pancreas. When the pancreas cannot produce enough insulin to control blood glucose, diabetes results. Type 2 diabetes is caused by multiple metabolic defects, but the fundamental problem is the inability of beta cells to make enough insulin for the body's needs. People with newly diagnosed type 2 diabetes may already have diabetes-related problems such as insulin resistance, high blood glucose level, developed prediabetes, and hypertension. Now, let's look at the natural history of type 2 diabetes, which is the progression of the disease process over time when not treated. The first stage of type 2 diabetes is insulin resistance. The body becomes less sensitive to insulin's commands. Initially, the pancreas produces the correct amount of insulin the body needs to keep blood glucose levels where they ought to be. However, at some point, cells begin to resist this naturally occurring insulin. This is referred to as insulin resistance, meaning the cells have a hard time using the insulin the body produces. The pancreas, in turn, receives a message that even more insulin is needed, and it begins to produce more than before to overcome this resistance. Second is the pre-diabetic stage. At some point, the pancreas is not able to keep up and blood glucose level begin to increase. This is what's known as pre-diabetes. Prediabetes means that blood glucose levels are higher than normal, but not high enough to be classified as diabetes. It is in this stage that 10 to 20 pounds of weight loss and 30 minutes of activity 5 days a week have been shown to prevent and/or delay the onset of type 2 diabetes. These steps also can improve blood fats and lower blood pressure, which can help to reduce the risk of heart disease. It is in this phase also that the pancreas starts to overproduce insulin at a rapid rate. Next, type 2 diabetes. The pancreas cannot continue working overtime indefinitely and will start to wear out. At this point, blood glucose levels rise high enough to be classified as diabetes. It is thought that by the time most people are diagnosed with diabetes, they have already lost 50% of their ability to make insulin in their pancreas. Lastly, type 2 diabetes and vascular complications. Patients with type 2 diabetes will have high risk of heart disease, stroke, high blood pressure, and narrowing of blood vessels or atherosclerosis. At this stage, along with type 2 diabetes, they may also develop other vascular complications like microvascular and macrovascular complications. This includes neuropathy, retinopathy, nephropathy, ischemic heart disease, peripheral vascular disease, and cerebrovascular disease. Common risk factors for vascular disease in diabetes include hyperglycemia, insulin treatment, dyslipidemia, hypertension, tobacco use, and obesity. Now, for more information on type 2 diabetes, let us watch the story of Mak Chicks and
One day, Siti and Mak Chicks go to the hospital.
Welcome, Makcik. Come, sit here.
This is Siti and Mak Chik.
How are you, Makciks? How are you feeling? Are you feeling well today?
I'm so tired. I feel so tired. Yesterday I fall.
Fall in love, Makciks?
No, doctor, no. I fall doing the house chores. I also keep drinking because I'm too thirsty.
Well, Makciks, I have to tell you this. Makciks, from previous checkup, you have been diagnosed with type 2 diabetes. This is your result, makciks.
Look, doctor.
It's okay, mother. We will do this together. I will take care of you. Doctor, what should my mother do?
Don't worry. I will prescribe your mother with metformin. This medicine. Makciks, you need to take this medicine twice daily. And not to forget, you need to take it after meal, okay?
What if I take it before meal?
Makciks, it's the best for you to take this medicine after meal to reduce the side effect. If you take it before meal, you may get diarrhea and stomach ache, makciks.
Doctor, I'm studying medic right now. Can I know the drugs? What can the drug do to help my mother?
Oh, I see. Firstly, this drug will increase the sensitivity of cells towards insulin by enhancing the peripheral sugar uptake from muscle. Secondly, it will inhibit the liver from producing too much sugar. Lastly, it will reduce the absorption of sugar into the small intestine, so the blood glucose level can be returned to normal.
Oh, thank you, doctor.
But makcik, if you experience any discomfort or allergies, you need to come to hospital again, makcik.
Noted.
Good.
How to store the medicine?
Firstly, keep at room temperature. Second, protect from light, heat and moisture. Third, keep away from children.
Mama.
Firstly, can do regular exercise. Need to control the weight and keep the heart healthy. And eat healthy. Eat meals and snack on schedule.